Yeah, thank you, Mayor, and thank you, Council, for the opportunity to report out again. Just continuing along with the Mayor's comments there, just like to start off these reports on just highlighting some of the work that's going on, often kind of behind the scenes. And today, just kind of contrasting two different types of scenarios that we have. First, with our field personnel, and the example I'm going to use today is with our Department of Transportation sewer crews, who their work is essential, continues on, and must continue on as it always does. But in this case, with modifications, with changes to how they do the work, and also in terms of how we do our shifts. The sewer crews work 24/7, but the team has had to stagger their work schedules so that we
Hey,
can.
I'm sorry. Can I ask Chief Garcia to please mute his? Thank you very much.
Yep. So thank you. So the DOT crews, other crews have had to do the same thing, have had to stagger their work schedules so that they are able to accommodate the social distancing and other safety requirements that we have for our field personnel. So just want to, and it took us a while to work through some of those issues, but really a lot of appreciation to the Department of Transportation for continuing to do all that work, not just the field crews, but the engineering crews that support them in terms of keeping the sewers working. And by contrast, the work that a lot of our office personnel do, that has changed greatly. A lot of our office personnel are able to work at home remotely. I want to just highlight the work actually of retirement services. They quickly had to move out of their office and start working at home, but also then realized that there were still things that needed to be done in the office. So certain employees needed to come in and receive mail and distribute mail. And just highlighting the work of Teresa Stichler in that office when she went in to do that mail work, realized that a mail had been coming in for employees and those employees needed that mail to do their work, and she was able to scan it all, send it all to them, get them the work and the information they need to do their job. So I just want to appreciate the work of all of our office personnel that have had to kind of make huge adjustments to getting their work done. Next, I want to really highlight the work that the public health campaign team has done. This is city staff and others with the help of Behavioral Insights team. The stay-at-home messaging, I think, has been effective. A lot of work around kind of testing different types of approaches through surveys in English and Vietnamese and in Spanish. Getting feedback from those surveys, incorporating that feedback into the messaging and putting it into production. That messaging has gone out to council offices and city departments. We've talked a little bit about the PSAs that have done in 6 different languages by some of our community leaders. And also the PSAs that have been done on radio in, I think, 8 different stations, 3 different languages. And I just can't highlight the importance of that communication work. I think it's going to be even more critical as we look forward and transition into the next phase, whatever that is. I think we're going to need to continue our ability to be able to communicate with the community effectively. Next, I just want to remind you, last week we went over, Jim Shannon and myself went over where we're at with the budget. We're not going to really do that again today, but just wanted to kind of highlight where we're at. And I really put it into kind of 3 phases. The next phase that the council will see, as we mentioned, is at the end of April, where we address the current year fiscal issues with some of our proposals to do cost reductions to be able to manage within the budget of the current year. And then for next year, the proposed budget that will be out in early May will really have a 2-phased approach. One phase will be a proposal for reductions that need to take place on July 1st, and another set of potential reductions that could be taken a little later on in August, September, should we need additional reductions. Later on in the presentation today, you will hear more on kind of where we're at with being able to get some recovery. But we need to have a plan in place if we don't get reimbursement for some of the things that we're doing. So that budget process, like I said, will be in 3 phases. The next phase will be the current year adjustments that we need to make at the end of April. I did just want to acknowledge the governor's announcement today at noon. I'm not sure how many people saw that, and I won't attempt to completely summarize it, but what the governor did is lay out a framework for transitioning into the next phase. They laid out plans for really the goals that need to be achieved and really the indicators that need to be able to be in place to be able to support a transition. There were 6 indicators that he identified: the ability to monitor through testing and tracing, the ability to prevent infection of high-risk populations, the ability for the health system to be able to support any future surges, the ability to develop therapeutics and treatment, the ability for businesses and schools and childcare to support physical distancing. And then the 6th and final was the ability to determine when and if we need to reinstate certain stay-at-home measures. And so I'm sure there'll be much more to come on this. I think what the governor stressed is we need a few more weeks of the current scenario to really ensure that things have stabilized and not to pull back too soon. But obviously, he was interested in being able to have a plan for transitioning forward, as I know many others are. And so I think that's work that we'll be doing in the near future. All right, I'm going to jump into the presentations from the team. So you're going to hear from Lee with a EOC update. Also, Lee and Jim Shannon on kind of where we're at with recovery and reimbursement opportunities through the different funding packages. You'll hear from Jim Ortball on where we're at with our emergency housing plan, and you'll also hear from Eddie, our police chief, on a public safety update. And so I'm going to pass that off to Lee next.
Thanks, Dave. Let me share my presentation with everyone. And while I do that, Councilmember Jimenez, it looks like you socially distance in the right place. So we have had a full week in our Emergency Operations Center. And as Dave mentioned, several of us are going to be kind of giving you updates today. Kip Harkness, our other Emergency Operations Director, is working with our local assistance team this afternoon, kind of on future planning efforts around food distribution, our broadband and connectivity to our schools, and starting to develop the city's plan for the next stage, which is kind of our post-shelter stage and how the city enters into that. So as we go over today's updates with you, we're really going to focus on 4 things: kind of updates on our food distribution program, updates on the homeless assistance, as well as the emergency housing recovery efforts, some updates from last week on the information that Jim Shannon and Benna Chang were able to share, and then hand it off to Chief Garcia to talk about some of our current trends in our crime stats. I did want to start by saying for all of you and our general public, what we are doing is working. We are flattening the curve and reducing the spread of COVID-19 in San Jose and within the county. On a per capita basis, the number of confirmed cases in our area is less than almost any large metropolitan area in the country. As you can see, some of the larger circles kind kind of showcase that. And as you can see within the County of Santa Clara and San Jose, it's quite small. So, this is because of the good work of many people in our community and the city. The city's been able to provide services to allow people to stay home, and our community is responding with incredible collective solidarity and staying home. As Kip would remind us, as he did last week, we are not yet out of the woods. It is critical to sustain the shelter in place for at least the next few weeks following county guidance. And we are feeding an awful lot of people as they stay home. In the past week, since you last received an update from us, we've added capacity in our program with the entering of a memorandum of understanding with Revolution Foods to scale to meet our peak demand based off of projections. This includes adding 750 meals per week in addition to the 1.8 million you see there. So it's a 42% increase of capacity that we're able to meet based off of peak demands on where our modeling is showing. We're also starting significant planning work around the governor's announcement and FEMA's possible shift to reimbursing some of our local and small restaurants in these feeding programs and how we might also incorporate them. And really, collectively, a lot of great partners are with us in this work, and centralizing all that work from resources, capacity, to even data reporting so that we can move forward and make data-based decisions as a group has been a challenge, and yet everyone has stepped up and been able to kind of move towards this centralized business model, and appreciate all of our partners and everyone in the city working on that. We're also sheltering a number of people in between the city and the county, over 2,600 beds countywide that we've been able to stand up. Just some highlights before I turn it off to Jim Mortball on this is our Parkside Hall is nearing capacity, and the South Hall will be ready starting tomorrow for any overflow that we are seeing at Parkside. And then the Camden Community Center will be open this Friday, focusing on families in need. And again, that'll open this Friday. And I'll turn it over quickly to Jim Mortball, Deputy City Manager and our Operations Chief, to highlight some of the great work going on in the emergency housing section.
Great. Thank you very much, Lee. So good afternoon. So since last Tuesday, when the City Council allocated state homeless housing funds to build emergency transitional housing to address the COVID crisis and the homeless shelter crisis declaration, we moved quickly to develop the first site at Monterey and Bernal. A site concept layout was developed last Friday by our Public Works Department. 30% plans will be completed by this Friday that a contractor will use to purchase modular units and to prepare the site to receive them. City staff is negotiating with Habitat for Humanity. They're the agency that built the Mayberry Bridge housing community. We're negotiating with them to amend their existing agreement to deliver the Monterey Bernal site. We can do that much quicker by working with them. It would probably be the quickest delivery method we have to stand up additional emergency housing units. Once that amendment is complete, we'll initiate site preparation right off the bat and then order modular units that will be placed on the site. That will be happening over the next couple of weeks. The schedule calls for this emergency housing to be stood up and available for occupancy in June. Early June is our goal, but it could be mid-June. Staff will be back to council next Tuesday to formally appropriate the funds that you took action on reallocating last week, the homeless housing assistance program funds. So that money will be recommended for appropriation next week. It'll be used for this emergency transitional housing. Will be a big chunk of that use. And then we're also exploring the other sites that we identified on that potential site list to figure out which ones can be developed and stood up within this emergency timeframe. So tremendous amount of work between the housing department, public works, city real estate, and the city manager's office to bring on as many emergency transitional units during this emergency as possible. So lots of work going on that front, and we'll continue kind of moving on a 7-day-a-week basis to advance this critical priority. I'll turn it back to you, Lee.
Thanks, Jim, and thank you for all your leadership and fast actions on those. We're going to turn to recovery, and I'll be handling the slides, but Jim Shannon is also available as the council has questions on these. Recovery, as we've started to mention, we've built that into much more of a direct kind of service within the emergency operations center, so that we're thinking of it during the actual event as opposed to something that's just after the event. And the way we've started to really frame this issue up, as we've talked to our local delegations at the state and federal level, is there's a lot of different pots of money and a lot of requests. So for us to organize ourselves, we've really organized ourselves around the three challenges of now, and how do we petition FEMA and other pots of money to deal with our direct kind of response to the COVID emergency, as well as what are the pots of money that will help stimulate our economy. And then as an organization, how do we look at lost revenue so we can continue to support both of those efforts? So that's been our frame as we've kind of entered the arena into recovery. And within recovery, this will be a rapidly changing kind of landscape as Congress and as the state legislature comes back. But right now, we're really kind of focused on the FEMA public assistance funding and program, where we're going to be seeing some upfront funding up to 50% for some of our response in the next few weeks, as well as the Coronavirus Aid Relief and Economic Security Act, or the CARES Act. I did want to just review what was presented to you last week, kind of the CARES framework that Congress adopted, and you can see that on the screen, and then just provide some brief updates that have transpired since last Tuesday. So on the economic impact and payments, those are expected to actually go out tomorrow. So that's $1,200 for individuals, $2,400 for married couples, and $500 for qualifying children, and that's all qualifying individuals and children. The federal administration did yesterday say they are talking about ways to address the unbanked households in the United States through issuing debit cards in the next several weeks. On the update around the Corona Relief Fund, just as a reminder, this is direct money to states and jurisdictions with more than 500,000, and I'm going to be touching upon that in future slides. On the HUD front, an additional $2 billion has been put into CDBG and the Emergency Solutions Grants, the ESG grants. We are working now to help inform kind of future guidance on the formulas and what that is restricted or not restricted for, and we'll be communicating that to the administration as well as Congress on future packages. And then on the FAA airport assistance, just as a reminder, these funds can be used for the purpose of which airport needs to to offset lost revenues, including debt payments, capital project, any payroll or operational expenses. Airport was on a call with the FAA today on the guidance for this $10 billion program, and happy to announce that the airport will be receiving just shy of $66 million in an initial grant as part of this work to help our airport cover costs through the end of the year. And as we start to implement that program, John Aiken and the airport will report out accordingly. One thing that's transpired over the last week is Congress was eager to talk about kind of CARES Act 2.0 and what that may look like. I think the realization came in for Congress that they needed to have some interim measures. So CARES Act 1.5, or kind of some bridging money for the economy and local government. So Democrats and Republicans at the federal level are working on an interim package to address some of these needs. Currently, Senate Republicans issued a bill that increased Small Business Administration's Paycheck Protection Program by $250 billion, but it did not include any other provisions. Senate Democrats blocked this proposal, instead trying to increase SBA hospital and local government relief as part of a bill. It should be noted that House Democrats have also issued a bill that would increase additional funding to the Coronavirus Relief Fund, which is our direct pot of money. The proposal did also clarify that the relief fund could be used for lost revenues for local government, which would be substantial for the County of Santa Clara and for the City of San Jose. None of those have moved forward this week, however. So Senate Republicans and House Democrats are still continuing negotiations on both those proposals. And we are working through the administration, as well as with our congressional delegation on communicating our needs through that package. On the CARES Act, we promised last week we would do follow-up on how this negotiation is taking place, and really Congress has been much more focused on the interim bills as opposed to CARES 2.0. However, it is still being negotiated quietly, and I'll be honest, how this takes shape, it really depends on what Congress's focus is. If it's still on addressing the crisis and the immediate need, the CARES Act for 2.0 will likely mirror what 1.0 looks like, including additional funding, additional repayments for any debts, capital projects, as well as we will be advocating for lost revenues for local government. If Congress is much more focused on the recovery, we're likely to see much more of an economic stimulus bill. Based off of our federal lobbyist conversation and working with our IGR team, it's much more likely this bill is going to try and accomplish both of those. But as we learn more, we promise to report out to council on what that looks like. On our statewide recovery program, just as a reminder, the state actions thus far, has been SB 89, which is $1 billion in funds for COVID-19 response. A lot of that has been focused on PPE equipment for our hospitals, as well as ventilators for our hospital and our systems for our first responders, as well as a direct allocation to cities and counties for addressing the needs of our homeless community. As we've started to work with the legislature and the governor's office, and I know the mayor's office has been actively engaged here on the recovery steps, we're starting to work with the state on the digital divide and state Department of Education on the digital divide and digital literacy programs, as well as potential loss in sales and property tax for counties and cities, as well as a stimulus program that the governor's been developing through GoBiz. And there's a lot more to capture there, but in the interest of time, I'll just kind of state that the legislature does reconvene on May 4th. And they are likely to take action on several fronts. So we will be spending time with our local delegation and the governor's office, adding kind of specificity to the city's request around those. The administration is also weighing in on a lot of future federal funding priorities, including the flexibility of funding for our own COVID-19 response, as we've discussed many times, focusing in on additional homeless funding, small business assistance, and support for undocumented and mixed documented families across our county and state. We're also scheduling, that'll happen later this week, virtual meetings with our congressional delegation with the Emergency Operations Center to focus in on what our relief efforts look like, as well as how we start to step out of this. And finally, we are coordinating closely with all of our partners at the federal level, the National League of Cities, and working closely with the mayor's office as part of the big lift with the big city mayors in the state and the U.S. Conference of Mayors, which has been a very important voice in our advocacy efforts thus far. And then lastly, before I turn it off to the chief, I did want to announce that yesterday at 12 p.m., the Treasury portal opened. And as a reminder, this is part of the CARES Act for the assistance for state and local government. This money needs to be used for the expenses can be used for any expenditures that were incurred due to the public health emergency that were not accounted for in our budget. And lastly, any operations that were part of our COVID-19 response that happened between March 1st and the end of this calendar year. Any city or county or state with a population of 500,000 or over are petitioning and going through the U.S. Department of the Treasury versus some of the other methods. So that's just roughly 170 local governments in the United States are petitioning through this. California, it is going to be based off of, throughout the United States, this will be based off of U.S. Census data and population. So for California, $15.3 billion will be available for assistance through this program. At 10:50 a.m. today, we did submit our first application for part of these relief funds. The portal included no guidance on methodology for disbursement of funds or a guidance on what the funds could be used for. However, that will be coming forward by this weekend and into next week. What we were able to submit was simply our financial statements as well as bank and routing information so the U.S. Department of Treasury can act very quickly next week as we start to petition and go with the guidance. So, important updates on the recovery front. I really do want to thank Jim Shannon for his leadership, as well as the rest of the recovery section for moving very quickly to meet these timelines this week. An awful lot of work went into this, but the recovery effort, as you all know, is important as we continue to address the crisis on hand. And with that, that is the end of the Emergency Operations Center update. I will turn it over to Chief Garcia for his portion of the presentation.
All right, I think I successfully unmuted.
Nice work, Chief.
All right, thank you. Little victories. So thank you for having me this afternoon. I know it's very important that we talk public safety with regards to what we're going through now. We'll kind of give you the plan that we've been kind of keeping up with. So in this short presentation, I'd like to give an overview of our health order compliance cars, how we're sitting on Part 1 crimes throughout the city, our computer-aided dispatch events. Those are calls for, in other words, calls for service that we're experiencing, and then department wellness. So I'll start off with compliance cars. So obviously we started the compliance cars back around March 16th, March 17th. And as of, obviously we needed to have an end date on when we're getting our data. So as of April 13th, we have our just compliance cars, because to remind everyone, it's 8 officers we send out during the day, 8 officers we send out during swing shift, have actually responded or handled 1,537 calls. So 1,537 total calls in these last few weeks. Some highlights of some businesses that they've responded to has been auto sales. They've handled 19 calls there, 4 bars, 15 cafes, 45 churches. This one kind of went up recently, 103 construction sites, 112 grocery stores, 519 miscellaneous businesses, 191 parks, 211 residential type calls. Those are individuals, neighbors calling on others in the neighborhood that they feel aren't following the order. 72 restaurants, 81 schools, 89 spa or salons, and 76 vape shops. To date, and I'll say this, and I've said this often, I'm proud of the majority of our residents in our community for abiding by the order. So far to date, we've only had to give out 3 citations. One is a report that's at the district attorney for review. As far as Part 1 crimes go on in the city, and this is basically how we're based on for major crimes in the city. One thing that I will pass on to the council members is that I sent a message over to our patrol division to ensure that all the division captains send their council members specific information to their districts, or specific information to their divisions. We'll stay from a divisional level because the numbers I'm going to go over are more citywide numbers, but the captains will be reaching out to their prospective council members to give out specific information on areas of the city. Now, we started running these numbers, Part 1 crimes, the week after the shelter in place. And so we have our data from March 15th, and to what I'm about to tell you is from March 15th to April 11th. And what we did is we compared that time frame this year to the same time frame last year to try to get a sense as to crime trends during the shelter in place, obviously, and a specific time when obviously we didn't. So violent crime in that particular time frame, which will encompass the entire shelter in place. Violent crime in 2019, and I'm going to deal with numbers on this first part because they're not huge numbers in this somewhat short time frame. So violent crime in 2019 total, we had 341 compared to in 2020, we have 255. Homicides in 2019, we had 3 to 2 in 2020. We had 41 rapes in 2019. We have 33 reported in 2020. We've had 3 domestic rapes in 2019 to 6 reported in 2020. We've had 126 robberies. We had 126 robberies in 2019. We've had 87 during the same time frame in 2020. We had 171 aggravated assaults during the same time period in 2019 compared to 133 in 2020. Domestic violence, we had 22 cases last year compared to 25 this year. Child abuse stayed static at 8 for both years. From a property crime perspective, overall in 2019, we had 2,063 cases during the same time frame. In 2020, we've actually had 1,403. Burglary in 2019, 338 compared to the same time frame this year of 278. Commercial burglary, 179 in 2019 to 167 this year. Residential burglary, 157 in 2019 compared to 98 this time period. Schools, 2 in 2019 compared to 13 in 2020, and I'll get back to that in a little bit. Larceny, 1,163 in 2019 compared to 685 in 2020. Auto theft, 562 in 2019, 440 in the same time period of 2020. For a grand total of Part 1 crimes, when you deal with violent and property, last year during the same time frame, 2,404 compared to this year during the same time frame, 1,658. Let's go back real quick to what we've seen a little bit, and I'll continue the presentation, but we've seen a little bit at schools. So we've seen an uptick at schools in some of our schools and mostly in our Foothill division. And so what we started doing proactively is we've conducted patrol checks, foot patrols, and made contact at schools. We've made over 1,000 foot patrols, patrol checks by school liaison units and our TABS officers, and 93 by patrol alone. We've done, so that basically it's 1,284 total patrol checks and foot patrols on the date range that we've been talking about, which is roughly around March 15th to April 11th. We've done proactive contact with 19 school districts, asking to secure expensive equipment, computers, etc., to offsite and do some other crime prevention tactics and techniques at those schools. There have been a series of burglaries. There have been about 9 burglaries particularly in or about this time frame. We've made 4 arrests in those burglaries. Obviously, as we've talked about many times, 50 burglaries aren't committed by 50 different people. So arresting these crews definitely helped us solve some burglaries and helped us prevent some in the future. With regards to, and I understand this is not just a local issue, but a national issue with regards to domestic violence and sexual assault, one of the things obviously is we have not seen, at least to this point, the fears that we have had with regards to these numbers spiking. But certainly we are keeping our eye on it and ensuring that we still continue to be proactive, as we've spoken about on many an occasion, how these crimes can be underreported. So some of the techniques that we're using is we're doing PSAs for domestic violence awareness. We're doing videos in English and Spanish and Vietnamese. We're collaborating greatly with our DA's office and the YWCA on messaging. Matter of fact, District Attorney Rosen is doing some written PSAs as well. We're monitoring our trends in the family violence unit. And again, this is just what the numbers bear. So far, we've not seen significant increases since the shelter in place. We've been conducting Zoom meetings with the Court and Community Partners Committee. This committee is made up of family court judges, DAs, public defender's office, private attorneys, NGOs, advocacy groups, and law enforcement agencies. The advocacy groups report also they do not see an increase in domestic violence contacts, and there have been no increases in domestic violence arraignments in family court per the judge, which is consistent with what we're seeing. Obviously, again, our messaging to our community has been one of continued outreach, of continued people to report, and things of that nature. We're actually in the process now of taking a deeper dive at the information, since again, I know some people have been very interested with with these particular areas, to take a deeper dive in a council memo to go through sexual assaults and domestic violence, to go over suspect info, victimology, location, and things of that nature, similar to something that we would do in PISFIS, but so that the entire council can see where we're at. Because again, as I will say, these issues are just not specific to San Jose, but it is a fear, a righteous fear, quite frankly, the longer a shelter in place goes on, I think nationally. As we move on to our computer-aided dispatch events, really, these are our priority calls that we go through. You won't see out of the calls that we go through, whether it's calls for service or officers meeting the citizen or doing premise checks, during the time frame. This is a little bit more truncated, but during the time frame of March 15th to April 4th in 2019, we had a total of 23,551 computer-aided dispatch events. In 2020, during the same time frame, we've had over 20,774. Of interesting note is the priority 1s and 2s calls, and those are our highest priority calls that officers get dispatched to. That during that time frame, and with this one I can talk percentages because the numbers are a little bit higher, but priority 1 calls during this time frame went from 638 in 2019 to 603 in 2020. So even with the shelter in place, our priority 1 calls only went down about 5.5%. Our priority 2 calls, we had 5,726 in 2019 and 5,244 in 2020 during that same time frame. So again, only down about 8.5% also. And so the officers are still doing a lot. There are some things that have slowed down a bit for us, but certainly making up for it with a lot of the contacts that they're making out with the community. As far as department wellness, we've, I think we feel like we've made great strides with regards to how we prepared for this, and the officers have responded admirably, not just the officers, but our dispatchers and our other civilian staff that we have. And so far to date, we have 5 department members that have tested positive, 1 sergeant, 2 full-time officers, 1 reserve officer, and 1 civilian staff member. But one of the positive things is also we've had approximately, and I think they're coming in every day, 37 negative results on some of the testing. And so again, that really concludes my overview of how we're at in this short time and that we're here, that we've had. But again, the department has responded amazingly. I couldn't be prouder of the men and women. And with that, that will be it for me.
Thanks, Eddie. And so, Mayor, that concludes staff's update.